Welcome back. I am Sister Tandy. In part B of this module, we go deeper into the actual examination process. This video is a step-by-step walkthrough of what happens from the moment you arrive at the clinic or when our mobile unit comes to your worksite. For employers, this gives you a clear picture of the professional standard your employees receive. For employees, this removes the unknown entirely. You will know exactly what to expect at every stage. Let us begin. When you arrive at the CareNet Consultants Clinic or mobile unit, the first step is registration. You will be greeted by the reception team and asked to provide your identification. Your appointment details will be confirmed, and if your employer has preloaded your information on My Clinic online, much of the paperwork is already done. You will be asked to complete or confirm a health questionnaire if you have not already done so. This takes approximately 5 to 10 minutes. The reception area is private and professional. No examination happens in a public space. Every step of the process takes place in a designated examination area under the supervision of a qualified occupational health practitioner. You will not be kept waiting longer than necessary, and you will be informed if there is a delay. Before any examination begins, the occupational health practitioner will explain what will happen and obtain your consent. Consent means you understand what each test involves and you agree to proceed. This is not a formality. It is your right as a patient. You may ask questions about any test before it begins. You may ask the practitioner to explain the purpose of a test. You may ask what the results of each test will be used for. No test will be performed without your knowledge and agreement. If you have a specific concern about a particular test, for example, a needle phobia or a respiratory condition that might affect breathing tests, tell the practitioner before the examination begins. They will accommodate you where clinically possible and explain the options available to you. Every examination begins with baseline measurements. These give the practitioner a starting picture of your general health. Baseline measurements typically include your height and weight, which are used to calculate your body mass index. Your blood pressure is measured. You will sit quietly for 5 minutes first, as activity temporarily raises blood pressure. Your temperature may be taken. Your pulse rate is recorded. These measurements are straightforward and take less than 10 minutes. If your blood pressure is elevated on the first reading, the practitioner will wait and measure again. A single high reading on a single day does not automatically indicate a problem. For employers watching this, the baseline measurements are the foundation of the examination. They are always performed at a CareNet Consultants examination, regardless of the industry or job role. After the baseline measurements, the practitioner will perform the hazard-specific tests that apply to your job role. These are the tests that vary from person to person, depending on what you are exposed to at work. If you work in a noisy environment, you will have an audiometry test. You will sit in a quiet booth or wear earphones and respond to sounds at different frequencies. This test is painless. If you work in dusty or chemical environments, you may have a spirometry test, a breathing test where you blow into a device that measures your lung capacity. If your role involves working with your eyes, operating machinery, driving, working at heights, you will have a vision screening test. If blood tests are required for your role, for example, if you work with lead or other chemical substances, a blood sample will be taken. The practitioner will explain every test before it begins, including what it measures and what the normal range is. Many examinations include a physical assessment performed by the occupational health practitioner or nurse. This may include checking your musculoskeletal function, your joints, range of motion, and physical strength relevant to your work tasks. For some roles, a urine test is performed to screen for conditions that affect work capacity or detect substance exposure. Throughout the physical examination, your dignity and privacy are fully protected. Examination rooms are private. Only the healthcare practitioner is present unless you have requested otherwise. You will be informed of what each part of the physical examination involves before it is performed. If any part of the examination causes you discomfort, inform the practitioner immediately. Your comfort matters. For employers who are watching this, CareNet Consultants operates to a nationally consistent standard across all 4 of our fixed clinics and 16 mobile units. Every examination is performed or supervised by a qualified occupational health nurse or medical practitioner registered with CNC or Health Professions Council of South Africa. Every test is performed using calibrated, maintained equipment. Every result is entered into the MyClinic online system, creating a verifiable digital record that satisfies the documentation requirements of the OHS Act. You can trust that when CareNet Consultants examines your employees, they receive the same quality of care whether they are in Midrand or Brackenfell or on a remote mining site in Limpopo. Now you know exactly what happens from arrival to the end of the examination: registration, consent, baseline measurements, hazard-specific tests, and physical assessment. In our next video, we focus on understanding your results. Whether you are an employer reading a fitness certificate or an employee receiving feedback from the practitioner, we will explain what everything means in plain, clear language. Remember, your best is good enough for today. Thank you for learning with me. CareNet Consultants, your partner in workplace health.